9 o'clock. We'll call the July 10th, 2018 Stearns County Board of Commissioners meeting to order. Roll call will show that all commissioners are present. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is the public access forum. Public access is for anyone wishing to address the board on issues that are not found on today's agenda. You may do so. Speakers are asked to approach a microphone, and individual comments are limited to 3 to 4 minutes. A citizen may speak at the public access forum once per month, and county board members will not engage in dialogue with the speakers, but rather refer the matter to the appropriate county department. And I know that we have Mr. Majeski here. That would be. That microphone, yes. Please give your name and address.
Yes, we're Elmer and Jenny Macheski. From Avon, we have an 80-acre farm out there. Pardon? What the address? 14183 360th Street, Avon. We have an 80-acre farm out there, and we have a grandson that is buying 40 acres of it. And that was fine until we find out that there can't be that many dwellings on there, being that he's going to build a whole home out there. Well, it was our house. Then we have a grandson living in an old mobile home over there, and he's trying to start concrete business, and he has a daughter. And in the wintertime, he'd probably be around, and in the summertime, she'd be able to help us, because we're both 84 years old. My wife has cancer, and I've had a stroke, so we kind of need some help. And they would be good for that, and we don't want to go to a nursing home unless we absolutely have to, and we'd like to stay in their house. And secondly, for a nursing home, that takes a lot of money too, which probably if we sold it for the acres, that would be eaten up in a hurry. So that's what we're asking for some help for. The thing is, we've been told that if he starts to build a house, then mobile home and him will have to go. And that's the thing that we're against for now. We're wondering if by chance he could stay around there as long as we're there. You know, I don't know what else to do. So that's where we're at.
Okay. We're at board members.
I see Shelley Benson in the audience. I'd like to have Shelley Benson come up and talk about this a little bit. All right. And then refer it to Environmental Services.
Good morning.
Morning, Angie.
Angie Berg, Environmental Services. Do you want me to address the situation that we've been dealing with, Elmer, or just come back to the next meeting with the information?
I'd like a brief overview.
We've met with the Majeskis, and they have 80 acres. They currently have 3 homes. Their home, their son has a home, and their grandson, as he indicated, lives in a manufactured home. So as the ordinance is written, you take the total acreage owned and you subtract 40 acres for each home that's on the property. And so in order to sell a 40 acres for a different grandson to build, he would have to, we'd have to work on a plan for elimination of one of the homes on the property.
Mr. Chair and Angie, I guess I would ask that Environmental Services work with the Majeskis and bring this back to the board and let us know what our options are.
Okay, thank you.
Thank you.
Thank you.
Okay. All right, Elmer, Angie's going to work with you, and she's going to come back to the board in the future, with giving us some options and things. Did you hear that? Did you hear that? Angie Berg there is going to work with you and then come back to the board at a future date. seeing what you've been able to work out.
I have a question here. Who sets the rules? It's a lot of the rules that the EPA goes by. Is
That
it-
environmental services goes by?
But the-
You mean environmental services?
Yeah, who the environmental services go by. You know, here's another thing. We have my mother's house is out there, and we have a son living in there because I sold him 20 acres, and then after he bought it, he found out he could not build out there. So, and he had nowhere to go, so he moved in my mother's old house. And now they tell me, being that it's grandfathered in, he could stay there for was up to 15 years, but I have to pay $2,000 for that. How come we didn't have to pay $2,000 before?
That would be an environmental services question, where that would, how that fits in. I don't know.
Yeah, I would
Not-
suggest that be part of Angie's discussion and bring back to the board.
And if Angie and Shelley can meet with these people right away now, that'd be appreciated.
Yes, they will meet with you right now. Is there anyone else to address things that are not on the agenda? Anyone else for things that are not on the agenda? Seeing no one, we will go to item B, which is the consent agenda. We do have a few additions there. Board members?
I'll move the consent agenda along with the two items that were added. One of them is emergency management, authorizing grant agreement with Minnesota Department of Public Safety for purchase of outdoor weather stations. And the second item would be the appointment of Larry Ladwig to the Sauk River Watershed Board of Managers for a 3-year term ending June 30th, 2021.
I'll second that motion.
Moved and seconded. Any discussion on the consent agenda? Seeing none, all in favor signify with aye.
Aye.
Opposed, motion carries. Item C is Public Works. We have Jody Pike here.
Good morning.
Good morning.
My first item is a cost share agreement with the City of St. Cloud related to improvements that we are going to make along County Road 74 near the new Tech High School entrance. The county board did award the contract to C&L Excavating in June. This agreement formalizes the cost share agreement per our policies with the City of St. Cloud. I know that there have been some questions as to why the school district isn't participating in these costs, and when the school district came to the county about their new entrance, they were just verifying that they could have their entrance where they were proposing, and they weren't asking us to do bypass lanes or right turn lanes, and this is an area of County Road 74 where the shoulders are a little bit narrow, and we were concerned if school buses started backing up, cars would try to get around the side of those buses on the right-hand side. We had situations similar to this by Oak Hill Elementary along County Road 136, which has since been turned back to St. Cloud. So it was the county's decision to be proactive with this, especially given that the City of St. Cloud wanted to extend their utilities as well. So that's why the school district, if we waited for them to participate, it would not have been done, and we would have had to be doing this under traffic after the school had opened. So this was the county proposed project. We're using sales tax dollars to do this, and I did want to give the board that explanation. And I don't know if there's any questions. Other than that, I'm just asking the board to approve this cost share agreement.
Mr. Chair, I'll move approval with that explanation.
Second.
Moved and seconded. Commissioner Merrick?
No, nothing.
Anyone? Seeing none, all in favor signify with aye.
Aye.
Opposed, motion carries.
My next item is related to resurfacing our Belgrade Highway Shop parking lot, and I did give you all a handout before the board meeting started. We just opened bids yesterday, so I apologize that this just got to you. Bids were opened on July 9th. The low bidder was Central Specialties with a bid of $108,622.07. That was about 4% under engineer's estimate, and I'm asking the board to approve this, awarding this contract.
I'll move that.
Second.
It's been moved and seconded. Discussion. Seeing none, all in favor signify with aye.
Aye.
Opposed, motion carries.
I have no miscellaneous unless the board has anything for me.
Anyone have anything for Jody?
Thank you.
Thank you, Jody. We are now to public hearing. We have Angie Berg here and
Good morning,
Shelley
Mr.
Benson.
Good morning, Mr. Chair. Shelley Benson, Environmental Services Director. I have Angie Berg here to go through our only item.
Good morning.
Morning.
This should be
Morning.
relatively quick. The board action today is requested to continue the public hearing originally set for today until July 31st. And this was upon the request of the applicant. He would like to have some engineering done to bring back to the board related to your concerns with flooding in the Two Rivers area. So recommended board action is to continue as requested by the applicant until July 31st.
I'll move that request.
The request has been moved. Is there a second?
Second.
Moved and seconded. Discussion? Seeing none, all in favor, signify with aye.
Aye.
Opposed? Motion carries. Thank
And
you.
that's all I have, unless you have anything.
And then if you would meet with the Majeskis,
Yep.
please.
Thank you.
Thank you. At this time, we'll recess the regular meeting to conduct the Human Services Board meeting. And we have Melissa Huberty here.
Good morning, Mr. Chair and Commissioners. I am Melissa Huberty, the Human Services Administrator, and this morning I have just two consent items. One is E1 and E2 on pages 34 and 35 in your packet, and wondering if you have any questions.
Anyone? Board members?
I had, let's see, Mr. Chair,
Yes, Commissioner Merrick.
on the tobacco license renewal, I know there was a late filing, and there's no penalty assessed to that. Are there extra administrative fees that are incurred when somebody files late?
Mr. Chair and Commissioners, on this situation, the person did actually get their application in time. It was just, it actually came in right under the wire, but either
Okay.
way, it would not incur extra
Okay.
fees or administrative fees.
Thank you.
Okay. What are the wishes?
I'll move approval.
Been moved. Is there a second?
I'll second.
Moved and seconded. Discussion? All in favor, signify with aye.
Aye.
Opposed? Motion carries. And now we have the regular items.
Yes, so on the regular board agenda, Human Services has one item, and it's F1 on page 37. You may recall in the April 10th board meeting, a request was made for an approval of an RFP submission to the Department of Human Services for a grant to develop a community living infrastructure. And I'm really happy to report that our proposal was accepted. And with me today, I have Julie Ellis, the Division Director over Community Supports, and Lee Lassard, a social worker in our Community Supports Division. And they're going to talk more about this exciting new innovative plan we're going to be engaged in soon. So, do you want to be in control?
Good morning, Mr.
Good morning.
Morning.
In 2017, the Minnesota Legislature passed a comprehensive housing package, adding language to the Minnesota Housing Support Act, Chapter 2561, to increase and improve opportunities for Minnesotans with disabling conditions to live in the community. The housing package included grant funding aimed at developing and supporting community living infrastructure throughout the state. The grant funding enables responders to apply for funding related to outreach, housing resource specialists, and administration of a housing supports program. The total amount of funding that was available for the program statewide was $1.4 million for the fiscal year 2018 and $1.4 million for 2019. The amount increases to $1.5 million annually beginning in 2020 and will be ongoing. I'm pleased to announce that our proposal was approved, as Melissa said, and we're here today to describe a little further what that effort is going to look like.
What the screen shows is what happens to an individual when they are in a mental health crisis, and a few of the current options, which include reactive services, such as jail, detox, or the emergency room. What we're finding is that ultimately, individuals cycle through these high-cost reactive services on a fairly frequent basis. After cycling through these high-cost options, it often requires a civil commitment. When this commitment is a Rule 20, or when a crime has been committed and the individual has been ruled incompetent, there's an increased cost, and we have less control over placement and release of the individual back into our community.
So we realized within Human Services that we were working with some of the same people over and over, seeing the same people going to detox, seeing the same people going to jail. What we didn't realize is that we had community partners that were seeing those same people, but we weren't actually talking to each other and working through a plan to determine what we're going to do in the future. So we kept going through the same cycle with the same individuals with no better outcomes. So we brainstormed a solution to work collaboratively and to plan for a new way to work with these individuals to help meet their needs and end the cycle of utilizing reactive high-cost services. And today I just want to recognize a few of our partners in the audience. I believe Dr. Lee is here from the Mental Health Center. Thank you. And Chief Bentrude from the Way Park Police Department. Yes. And Heather Cornell from CentraCare. CentraCare has been a very strong partner in this collaborative, and they have actually applied for a grant as well, and will be providing, I believe, 2 paramedics, community paramedics, that will be embedded in the St. Cloud Police Department. St. Cloud PD could not be here today, as well as several of our other partners, but I just wanted you to see that this really is a collaborative effort. It isn't just Human Services that is working on it. Uh-oh. Thank you.
So currently, we have the PATH Social Support Group, which is myself. PATH stands for Projects for Assistance in Transition from Homelessness. This is a grant-funded position. Stearns County has had this position for 14 years. I've been in this position for the last 4. What I do is I provide outreach and referrals to people with serious mental illness who are experiencing or at imminent risk of homelessness. The numbers of individuals we should be reaching out to far exceeds my own capacity. In each of the past 2 years, I have had approximately 300 unique contacts with individuals experiencing homelessness in our community.
So what the grant is going to allow us to do is to add 2 new positions, the first one being the outreach social worker. That social worker will really complement the work that Lee is doing at this time. So he or she will be working out in the street, working with people, forming relationships with them, building some trust. At some point, we anticipate that they would be ready to work with us and accept services. And at that point, we would refer to the housing resource specialist, who will become our housing expert. Housing is a very complicated issue in not just Stearns County, but it seems in every community. It's difficult to maneuver the bureaucracy of everything that's required to do all the paperwork, do it accurately, and then to follow up, get on the right wait list, and then to figure out what you're going to do in the meantime. People generally just give up on the process, and that's where we've seen people just fall through the cracks. So we think this housing resource specialist is going to be really key. The first thing they're going to have to do is to coordinate all of that information so we know exactly what we're working with and who really belongs where. We're also hoping that they will be able to work on relationships with landlords and other housing support providers. How we identify who we work with, we've actually started this work. Lee has started this work with our community partners, and we have actually identified a number of individuals, probably 15 or 20, that we have started to work with, and we'll continue to do that. Any of our partners could say, this is somebody that we think should be higher up on the list. Can we start working with them right now? We still won't have a lot of resources to do this work, but adding the 2 FTEs will help significantly. So the purpose of the grant is to help disabled people live successfully in the community. When we first started doing this work, we found that about 90% of the individuals that were cycling through that diagram you saw were homeless. So if we are able to provide appropriate housing, that should prevent the need to utilize these services and ultimately result in better health. So the project timeline is already started July 1st through next June. The goals of the project will be to secure housing for 20 people by next June, by the end of next June. We did request funding that wasn't approved for a data analyst. That would have been a 3rd FTE. They approved 2 of the 3 FTEs we asked for. The data analyst would have put together a software system that we could have used to be more up to date on what places have openings, who's taking what type of client. So we won't be able to pursue that. We'll have to do something a little less elaborate. but we think we can still make that work. So one of our goals that we're hoping to accomplish is to decrease costs for our jail, for the mental health center. Mainly detox beds would be what you might be mostly concerned about because that is all county levy dollars. And then local hospital emergency departments, they are expected to realize a cost savings as well.
This project was funded through the Community Living Infrastructure Grant Program through the Department of Human Services, which was authorized by legislature. The total amount awarded to Stearns County was $187,211, which completely covers the expenses listed on this screen. At this time, we anticipate no further costs. This is a picture of a camp that I visited. An individual, we'll call him John, that's not his real name, was living in this camp. This was the place that John called home. When I first met with John, he was homeless, living in the camp that you saw on the screen prior. John wanted a better life. He didn't want to be living in a tent. He didn't want to be living outside. He wanted to be safe, he wanted to be sober, and he wanted to live the life that any of us would anticipate living. John unfortunately didn't have the services and the resources to be able to do so. However, when I met with John, he was willing to accept services. We were able to get John into see a psychiatrist and get him on medications. We were able to get him in to see a medical provider to address his physical health conditions that were limiting his ability to work. And we were able to get him into treatment. John successfully completed treatment after about 6 months. During the time that John was in treatment, he decided that he wanted a better life and he wanted to have housing. So John was willing to accept a placement in a local boarding lodge where he has been living successfully for over a year now. Again, he did successfully complete treatment. He has maintained his sobriety the entire time. He's successfully completed probation, and he continues to address his mental health needs, taking his medications and following his treatment plans and goals. Recently, through our SOAR program, which is a Social Security and Advocacy Outreach program that Stearns County also implemented, we were able to get John on Social Security disability. He now has achieved financial independence as well. We're now looking at independent housing for John. What a complete turnaround in the last year.
So this is truly a community success story. And it's a story that started before this grant started, certainly. And it was something that began before we started even recognizing who people were that were high utilizers of these reactive services. So John wouldn't have been somebody that we would have selected as a high utilizer. He actually was a pretty low utilizer in comparison to some of our individuals. And I just say that because these numbers would be even more impressive if he was a high user of services. So a year before Lee started working with John, John had 6 different interactions with law enforcement, 3 different law enforcement agencies. We anticipate, or we're using a dollar amount of $200, and this is from the St. Cloud PD. It's a very low estimate of what one interaction with law enforcement costs. So in that first year, about $1,200 in law enforcement interactions. John spent 12 days in detox, which sounds like a lot, but really we have some people that spend 12 days in detox in a month. So again, he's a low utilizer in comparison to some of our folks. So at $330 a day, which is what the rate was last year, that's almost $4,000. He also had 6 visits to the emergency room. Oftentimes people who are cycling downward will visit the emergency room. They don't have a doctor that they see regularly, so that's where they go for all their medical care. And I think Centra Care is pretty conservative in their estimate of $1,500 per visit, so it's maybe a little bit low, but those costs would have been about $9,000. And he also spent 8 days in our local jail. Could have been in other jails too, we don't have that information. But our cost is estimated to be $212 a day. Again, I think it's maybe a little bit low, but that's about $1,700. So the year before we started working with John, a minimum of almost $16,000 was incurred in direct costs. A year after Lee started working with him, there was 1 interaction with law enforcement. So $200 was the direct cost involved. He spent no time in detox. He spent no time in jail that we're aware of. and no visits to the emergency room because he was connected to a primary care physician. So this is really a great community success story. The financial savings is really just an extra benefit, in my opinion. The real success is that he has improved mental and physical health, and he is a member of our community now that is doing well.
So what John's story looks like now and ongoing is that he has obtained financial stability and independence. He's had no utilization of reactive high-cost services, and he had successful completion of probation and treatment. We're looking at independent living for him, and he's had improved health outcomes, both physical and mental health.
So in John's case, it did become apparent that we needed to work with community partners, and we did that. One of the difficulties we had, and we will have in the work that we're proposing to do, is that we cannot freely share information with our community partners. Rather, we must get signed releases for each provider. So this is a challenge that we're looking at solutions for in the future. Today, I would ask the board chair to approve the grant contract and sign the grant agreement as well as the resolution. Do you have any questions for us?
Anyone, any questions? Commissioner Linsmeyer.
It isn't that this is a bad idea. In fact, it's an old idea. As long as I've been here, it's been always challenging dealing with, I call them multiple hitters. They're people that simultaneously are interacting with law enforcement, county attorney, public health, human services, fringe folks that just have trouble connecting the dots in life. Historically, the challenge in dealing and coming up with better ways to deal with this has one ironic obstacle was data privacy regulations. Agencies and nonprofits and various government entities, even county to county, couldn't share that information. What's going on that's different now that this shows a little more promise?
We decided to try to find a way until we could have a legislative fix or somehow fix it comprehensively. We looked at what we could do, and what we found was that law enforcement's data is public. So what they have done is, just this morning I had an email that one of our, I forget the term that you used, Commissioner Linsmeyer, but a higher utilizer of services was booked in the jail last night. So Lee or someone will be going over to meet with them, and we'll start working with them. That isn't something that we were doing before. We weren't reaching out and providing outreach services because we do not have people to do that. We have all we can do to provide services to the people who are saying, I want services, and they're coming to us. So this is a new approach, and we're going to work off of the public data that we have. It is a little crutchy for us to work together and to have dialogue unless we have those signed releases. But Lee has done a very good job of talking with people. And I think the changes that we've had in our jail have helped too, because when people are coming in and they're receiving medication-assisted treatment for substance use disorder, they are more willing to work with us and are more willing to sign those releases and look at the next steps. So I feel like it's just kind of, it's all coming together, and we're finding ways to make it work, but it is a challenge, and it is going to be a barrier. You're definitely right about that.
Mr. Chair and Commissioners, I would just add that having a couple more staff out in the community to build that trusting relationship is more of a preventative effort, and it really is the trust relationship that gets us to the point working with people where they're even willing to do some of the steps that help us do the communication without a legislative fix.
And from the other side, you're dealing with a population that, by their very nature, they're paranoid folks. I mean, it doesn't address or indicate anything about their respective character. Just that if you been kicked into the curb enough, you shouldn't be surprised that's an end result. So this is, I wouldn't call it a start. I mean, it's, you folks, despite your youth, are obvious veterans at dealing with this population. The more we can do of this, where people are sharing information, the better off we will be. As you indicated, there aren't all that many of these folks. It's just that they touch the system so many times, and it results in a significant increase in costs.
Mr. Persky.
Yeah, I'm just curious if we have any idea about the scope of the situation as far as numbers that, are involved with this revolving door between, the hospital, between, the jail and, other issues.
As I stated in our presentation, in each of the last 2 years, I've had roughly 300 contacts with unique contacts, so meaning at least one with 300 individuals in our community. Yeah.
How many are in a situation, though, that are, what I say, chronically maybe within those revolving doors, as far as, there's incidents maybe once a week or
Sure.
several times a month? Or?
Sure. Over the past 6 months that we've really kind of been beginning to work on this project, we've identified approximately 15 to 20 individuals who are cycling through these at a pretty rapid rate.
That's probably a conservative number, because what we don't know are the emergency room visits, because that information isn't public information and can't be shared.
Okay.
So I think that would be a minimum.
Do we find this somewhat seasonal, though, too? Do the door numbers go down in the winter?
Unfortunately, no.
Okay. They find other places, yeah. Okay.
Mr. Merrick.
First of all, thank you for your presentation. Anytime that we can collaborate and save dollars and point people in the right direction, we're doing the right thing. And this is a step in the right direction, as Commissioner Lenzmeyer said. I have a couple of questions. Number one, are we the only county in the state that's doing this? I mean, we have 87 counties, and it says Stearns County Human Services Board, approved the RFP. What about the other 86 counties?
There were other applicants. Other people did respond to the RFP, and I believe there were 17 awards made. It hasn't been made public yet who all the recipients are.
Okay. I'm not sure if it's possible, but the example that you gave about John, about the cost to the system and the savings, if we could somehow develop a report that shows that for everybody in Stearns County and for everybody in all 86 counties, and then share that with the legislature, maybe there's something that could be developed that gets on the front of this rather than at the end of it. It's always hard to quantify, but if you if you have a report that expands, that brings everything into focus, I think that'd be good. It also says here that we're looking at this grant contract for the period of July of 2018, which is now until June 30th of 2019. What happens on July 1st of 2019? Does the system go away or what?
No, we'll be reapplying, so we'll be coming back to you to show you our progress. We can show you our progress before that if you'd like. I love your idea about tracking, what it looks like a year before, a year after, and we are setting up a system so that we're going to be able to do that and report back in. It would be wonderful if all 87 counties would do that, or at least the 17 projects that, have something going on, and I'll certainly carry that forward and suggest it, because the software that we put together, I think, is pretty friendly.
Yeah, I think you need to share that with your association, with the MC, and even with NACO. I mean, but what happens on July 1st of 2019? The funding runs out. Is it, or where does the funding come from for July 1st of 2019 until the end of the year?
Okay. Well, the legislature did appropriate funds for 2 years, and then the actual language in the statute says "and ongoing." So after that point, we'll need to reapply, but it is our expectation that that's not the end. And as long as we're demonstrating some success, we have every hope that we should have that we'll be funded again.
Yeah, Mr. Chair and Commissioners, I would just add that that's a little bit more unusual for grants to say that they will be ongoing, which was one of the reasons why we actually thought to apply for it, because we knew that it was very unlikely to end after 1 or 2 years. I mean, anything could happen in a few years out, but it's unusual to put the ongoing in there like that.
Okay, so there may come a time when there is no grant money, and then we would be asked locally to take care of this. Is that a possibility?
Mr. Chair and Commissioners, that's always a possibility, but in this particular case, I don't anticipate that in the next few years, and I would, with success of it, I would think we would have savings, and then we would be moving forward anyway, because it only makes sense.
So the better job we can do in preparing a report
Yes.
that shows the cost to the system,
Correct.
then it's easier to support things like this. Thank you.
Yeah.
Anyone else have any comments? Mr. Persky?
I'm just curious, Mr. Chair. As far as the issue is concerned, are most of these people dealing with addiction, or should I say involvement with alcohol or drugs? As far as, would there be some that are just actually just mental health issues, but does the overlying issue seem to be with substance abuse?
I would say the overlying issue, sorry, I'm going to
Oh,
jump
go
right
ahead.
in. I would say the overlying issue is the mental health concerns. However, a great number of them also have co-occurring, where mental health and addiction is the issue.
Okay.
Anyone else?
Mr. Chair, I'll move approval of the recommendation.
I'll second it.
It's moved and seconded. Any further discussion? All in favor, signify with aye.
Aye.
Opposed? Motion carries. Thank you.
Thank
Melissa.
you.
Thank you.
Thank you.
And we'll now close the Human Services Board and reconvene the regular county board meeting. And we're up to item G, the last item, which is issues by commissioners. And we'll start with Commissioner Merrick. Do you have anything for today?
I don't have anything. Thank you.
Okay, Commissioner Persky.
I have nothing.
Commissioner Notch.
Just a reminder, the Stearns County Fair starts on July 25th and goes till July 29th. So encourage all residents of Stearns County to venture out to Sauk Center and pay the fair a visit.
Commissioner Lenzmeyer.
Nothing.
I have an item that I brought up before, and I would like we made a $10,000 award to St. Cloud and the St. Cloud Economic Development Authority, and again, I would ask that would be revisited because the commitment was made based on false information that was given on the exact day that the commitment was made. And then now, upon having some time to review that information, I have several questions that I'd like to have answered. And Dr. Williams has I think, somewhat volunteered here today to make a comment as to the process we should be going through to do that.
Mr. Chair, first of all, the board took the action it did, and it appropriated the $10,000, and then we put it on the agenda again. And if according to Robert's rules, if you were going to change your mind, the board was going to change its mind, rescind that action, Robert's rules will have you do that at that next meeting, and someone on the prevailing side would have to make that motion, and then if you wanted to make, change that decision. And after that first meeting, and some of the errors in the report were found, I did communicate with the EDA, with Kathy Mihalich, and then she sent me back a corrected copy, which I then distributed to the board, just to jog your memory. And so what I suggested to Commissioner Mergen when he asked me about it today was that he would visit with the board about that if he really wanted to reconsider that action. I'm not exactly sure how we would do that. I suppose there would be a way to suspend the rules or something that would allow you to deviate from Robert's rules if you really desired to. But given that explanation, I didn't see it necessary or needed to be put on another agenda unless the board moved that, I guess.
Okay, when I had asked to have it put on the agenda again, I had also asked for them to be present to answer questions, and they neglected to show up for that. So, Commissioner Notch.
And I guess I would look at it possibly, okay, there was an error made. Was it blatant or not?
It was quite blatant, in my estimation.
Because there'd be a difference if, okay, something got overlooked and the correction was made, and it was just human error. I'm not sure if it would at this point affect the decision to prove it or not. I guess if it comes forward again, well, it probably won't because it was a one-time request, I would imagine.
But even if it was human error and passed on that error, it should, in my estimation, be relooked at.
True.
How about a suggestion that they ask the agency to submit data in a more acceptable format? And more acceptable format gives them plenty of latitude to make suggestions or present the information in another way. And that will allow us another look, and if we got another look without taking action, if after we look at it again and review their submittal, then if action's required, then we can take it. How's that for a middle ground? Will that work for you guys?
Who gets to decide what's a more acceptable format?
I'd let them take a shot at it, you know?
'Cause
I mean, part
like-
of this process is building trust, and also you're dealing with folks that have government backgrounds, so leave it up to them. And if it doesn't pass your muster, kick it back.
Because I would have some suggestions as to what should be included in the more acceptable format.
Make your request.
Okay, my request would be that of the 703 total employees that responded, that they break it down as to what percent are in the metro area. And the metro area would include St. Cloud, Wade Park, Sartell, Sauk Rapids, St. Joe, questionable whether you call that in the metro area, but let's say it's out where it's out in the county. Also, what percent breaking down, because they put Sauk Rapids in Stearns County, all of those employees, and they put all of St. Cloud population in Stearns County. So I'd like to have it broken down as to what percent are also in Benton County. And then Morrison County had a fair amount also. Those for starters. And then I'd also like to know what the response was from Benton County when they went and asked them for a donation, and what the response was from Wade Park, and what the response was from Sartell, and what the response was from Sauk Rapids when they asked them for donations.
Mr. Chair, I don't believe the cities were asked for donations. There was a list in what they submitted of who they were asking for appropriations or donations. And I think I know I can't speak for them, but the tax base is in the city of St. Cloud, which is, I think, what drove that decision, and in Stearns County, which is what drove that decision.
Mr. Persky.
Yeah, I guess I would just like to, I don't want to bring back the bigger picture, but I think it's worth noting about the bigger picture, in that I think we're looking at, the loss of those jobs at Electrolux, and we have an opportunity. Was it to get a matching grant? Was it like if we were able to get up $140,000 that we'd get a matching grant of another $140,000, and where those dollars were going to go? Well, if those dollars were going to go to a way in which we could find places for these people to find earlier employment, if we could find ways that we could maybe find something to come into that location, if there was ways that another way perhaps to utilize that location that would bring some jobs back, I think collectively, by putting that money in, those dollars are going to come back earlier to people that would have jobs, people that would have employment, and maybe get some development on that property, so that those are dollars that would come back to the county and come back to the area quicker. So.
And with that, I go back to the Melrose situation.
But
where that's a bigger economic impact, in my estimation, on that community than this is on this community.
I think we were looking at 900 jobs and auxiliary jobs as well out there at Electrolux. I mean, I don't think it's apples to apples comparison.
I would have to disagree with that. Okay.
Mr. Chair, just procedurally, the City of St. Cloud EDA was told that the appropriation was made. I wrote a letter that committed that we would take care of that if they got the grant. So, which is really the reason for Robert's rules, so that because once you take action, we begin to implement. So it would put the administration in a very awkward position if we're uncertain about this. And so, but they haven't gotten the grant yet. But I just want to state that, that action was taken, and the administration is now obligated to do that unless the board wants to try to do something else. So timing is important.
You know, and one other thing, this, to me, this is the number one exhibit as to why we should have some formal practice or policy or however we want to do it. And when things are given to us the day of, and we're supposed to make these kind of economic decisions, that it automatically does not go, taken care of that day, that it goes to the next board meeting. So we have some time to digest things and review them. Commissioner Merrick.
Yeah, on that particular point, I agree that last-minute things are really, really difficult, and if any board member has difficulty with it, then we should move to postpone action on whatever item comes forward and say, I'm sorry, we're not going to take action on that today. So, and I think we mentioned that at the last meeting as well, and I think administration has that, so the word is out there that if you bring something last minute to the county board and any board member has a question about it, we may very well move to postpone action until a future date. So, and I think that word is out there. So I guess that's all I have to say on that.
I think, you know, if the board wants the administration to do something different than has occurred, then we need clear direction today, not a suggestion. We need I think I need some kind of action from the board today. Otherwise, I'm obligated to implement what you did 2 meetings ago.
And as you said, it would have to be somebody to bring it back that voted in favor of it, Dr. Williams?
Yes.
Okay. So it would have to be someone other than me.
Right.
Okay. Does not appear that anyone else is of that. Commissioner
Well,
Knapp.
if I can make just one more comment, you know, I'll agree. I didn't think maybe the numbers of employees and where they were from was probably very representative, but you know, just in following this along, you guys have probably heard the ads where they're looking for temporary help for sign-on bonus, and then you know, another payment once the plant closes. Mm-hmm. I have to believe it would have been a nice statistic to include of the original when they started this, you know, how many employees, and you know, how many actually had dropped down, because I have to believe people who were aggressive and would say, I'm going to get out there and find something else, went and did that right away. So I have to believe, you know, they're probably short on laborers right now. You know, so it'd be interesting, the statistic, to know how far down, you know, they've dropped already.
What that indicates is that these people are already having success finding other employment on their own.
Correct.
So is there anyone else in favor of making such a motion? Seeing no one, this meeting is adjourned. Neil, did you wish to